Hey, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzo.
And I'm Dr. Brad Wiening.
So this is our redo of our introduction video because our site has changed and our videos have changed since we started this a few years ago.
Yeah, so over 2 years and I think over 75 videos. The nature of our product has changed, and we just kind of want to give people an idea of what the purpose of it, what's it for, and how to use it best.
So we kind of were thinking about it, and there's basically, we found 5 ways that you people are using our video.
Okay, number 1.
You can't sleep at night, you need something boring to loop to help you fall asleep. No,
that is number 6.
Okay, sorry. Number 1 is you're one of our patients, and we talked to you about something in our office, and then you go home, and maybe I was mumbling, maybe Dr. Wiening was mumbling, or whatever the deal is, you want to hear the information again. And we know that that happens. People forget when you go home. What's the study say?
So 60 to 80% of everything that you hear is forgotten before you leave the office.
What'd you just say?
Exactly.
Okay, so you forget the stuff when you get home, so you can watch it again to remind yourself.
What I tell my patients too is that it's in a relaxed setting. You can pause it. You can have a glass of wine if that's your thing. You can watch it over and over again if you feel like you didn't quite get it. Yeah, it gives you an option to do it on your terms.
Okay, number 2.
Number 2 is, on a similar vein, if you have a friend or a family member that is either interested or cares about or wants to know what's happening or what the plan is, they can learn the exact same information.
Mom came to see us, she went home, daughter says, what did the doctor say? Oh, he said I'm fine. Oh, he didn't say much. What? Now you can watch the video and see pretty well what we said, because we say the same thing over and over a lot of times.
And particularly as a lot of our joint replacement patients age, we are operating on people in their 80s and sometimes in their 90s. The siblings, who are often in their 60s and 70s, are partially responsible for their care afterwards. So they want to know what's involved, how risky is this, how long are you going to be in the hospital, how long is my mom or dad going to be on a walker, a cane, or whatever.
Okay. Now the third reason we made these videos is because we wanted to get on Ellen. That never happened.
Has not happened yet.
Yeah. So really the third reason we made these is, let's say you have an appointment to see an orthopedic surgeon and you want to go in there to have some intelligent questions that you can ask. Okay, so you can watch the video related to the topic that you're going to go see the surgeon about, and then you might be able to have some intelligent questions to go in. Not that your questions aren't always intelligent, but you might have some intelligent questions that you want to ask your surgeon, and you've done a bit of research. So we just give you sort of the bread and butter stuff in simple terms with no fluff.
So you are a patient, you're just not our patient. This could either be before your first visit or maybe after your first visit, before your follow-up visit, whatever. That's number 3. Number 4 is if you are interested in medicine. So you could be a student, a physiotherapy student, a medical student, a nursing student, whatever, or you could be a practicing allied healthcare professional, or someone who's just really into YouTube medicine videos.
Yeah, there you go. And you want to learn something. Okay.
Yes.
Good. Was that 4?
That's 4.
Okay, so I would say the 5th way that we've seen our videos used, and you may want to use it, if you're in a part of the world where you do not have timely access to get to see an orthopedic surgeon, watching these videos may buy you some time, but be careful.
It is not a substitute for an assessment by a healthcare professional.
Yeah, our medical legal aspect has to make us say that. We don't want to replace your orthopedic surgery consultation, but if you're in a part of the world where it's hard to get to see an orthopedic surgeon and you want to get some answers quick or educate yourself quickly, you can use this video.
And over the last almost 3 years, we've seen comments and views from over 250 countries.
We love your comments. Please keep the comments coming with the questions and video suggestions.
It's really important. It helps us know that what we're doing is making sense and also helps produce further content. But what I was going to say is that we had someone that actually asked a question from the middle of like a hurricane zone. So they couldn't get access to care, and they're just like, listen, here's what we got. So we kind of problem solved it a little bit, saying ultimately you need to be seen, but in the short term maybe you can try this. And then other people in third world countries that have very, very advanced problems to say, listen, you really need to be seen.
Yeah, and even in developed countries,
yes.
in parts of those countries, there's still not equal access. In Canada, we know up north, there's not always great access. So
yep.
We get questions and comments from all over, and we really appreciate it. Those are basically the 5 reasons. And you know what, we do all the for majority of our videos, we've done all the editing ourselves. That's why we don't have any of the fancy stuff where they zoom in on a face and say something important and zoom back. To do that, you just have to step forward to the camera. just like that. Very good. It saves me a lot of time editing later.
Yeah.
And most of our videos are done in one take. Unscripted, you may be able to notice.
I was going to say, you probably can't tell,
Yeah.
but yeah, so we just try to do one-offs. We try to be as authentic as we can to provide real information in a timely fashion.
The other thing that's changed too is we've branched out of orthopedics into parts unknown to us. So
Yes, general surgery.
Yes, we've done some general surgery stuff, we've done some anesthesia stuff, we've done some pain management stuff, and we've got more branching out coming out in the near future.
Yeah, lots of exciting possibilities going forward. So please, if you like our videos, please like them, subscribe to our channel, tell your friends, spread the word.
Thank you so much for watching, and remember, you are in charge of your own health. Enjoy the videos.
See you next time.